Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, an overview of level of consciousness lock. Level of consciousness, LOC, is a medical term used to describe how awake, alert, and aware you are. It also refers to how well you respond to attempts to get your attention. A person with an altered level of consciousness may have decreased cognitive function or be difficult to arouse. /r/n/r/n A variety of medical conditions and drugs can affect your level of consciousness, from having dementia or lethargy to being in a coma. Sometimes impaired consciousness is reversible, while other times it is not. /r/n/r/n This article covers normal and altered states of consciousness as well as coma classifications. /r/n/r/n Medical definitions say a normal lock means a person is either awake or can be readily awakened from normal sleep. Terms include, /r/n/r/n Sleeping is not considered unconsciousness if waking up would result in normal consciousness. Between consciousness and unconsciousness there are several altered levels, each with its own definition. /r/n/r/n Altered or abnormal levels of consciousness are states in which you either have decreased cognitive function or cannot be easily aroused. /r/n/r/n Most medical conditions affect the brain and impair consciousness when they become serious or life-threatening. An altered lock usually signals a serious medical problem. /r/n/r/n If you are at risk for altered lock, be sure to have the proper medical precautions in place. For example, wear a medical alert bracelet or download a phone app that lists your diagnoses, medications, and emergency contacts. Some apps can be accessed even when your phone is locked. You may also want to designate a healthcare proxy to speak for you if you are unable. /r/n/r/n Often, an altered lock can deteriorate rapidly from one stage to the next. They require timely diagnosis and prompt treatment. /r/n/r/n Confusion describes disorientation that makes it difficult to. /r/n/r/n Causes include, /r/n/r/n Delirium is a term for an acute confused state. It involves impaired cognition, thought processes, and may include, /r/n/r/n Causes can include, /r/n/r/n Lethargy and somnolence, sleepiness, involve, /r/n/r/n A lethargic person may need a gentle touch or verbal stimulation before they will respond. /r/n/r/n Causes can include, /r/n/r/n Obtundation is reduced alertness with, /r/n/r/n Causes can include, /r/n/r/n Someone in a stupor responds minimally to vigorous stimulation, such as a pinched toe or light in the eyes. /r/n/r/n Causes can include, /r/n/r/n A person in a coma does not respond to any stimuli. Their pupils may not react to light, and they may not have a gag reflex. /r/n/r/n Comas are caused by severely diminished brain function. This is usually due to, /r/n/r/n The causes of altered lock may overlap. For example, the early stages of brain edema or organ failure can cause confusion but then advance rapidly through lethargy, obtundation, stupor, and coma. /r/n/r/n Levels of consciousness can be subdivided into levels that further clarify your degree of unresponsiveness. That helps improve communication among healthcare providers as well as aiding in research. /r/n/r/n Several systems have been developed to standardize these classifications. The most common classification systems are, /r/n/r/n Nurses may evaluate lock based on the following categories: /r/n/r/n Levels of consciousness range from normal alertness and attention to gradations of altered states, including confusion, delirium, stupor, and coma. /r/n/r/n. The same conditions may produce mild to severe states of altered lock. Sometimes, there may be a rapid progression from a mild to a high stage. /r/n/r/n. Coma scales can help describe the exact level of consciousness. /r/n/n/r/n/r/n. Thank you. Form.email, for signing up. /r/n/r/n. There was an error. Please try again. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.